What do we do about this? Well, increasingly, I find that when we give talks about climate change and health, everybody is asking, what can I do? Well, we know there are several things that need to happen so that we can address climate change. We need to decarbonize. We need to draw down the carbon dioxide that's currently in the atmosphere. And then we need to figure out how we can protect ourselves from the heat and the torrential rains and the vector-borne diseases and all the problems that we face because of climate change. So our organization and others several years ago published something called the Call to Action on Climate, Health, and Equity, a Policy Action Agenda. So why equity? Equity because although climate change places everybody at risk, there are certain people that are at greater risk, and that includes vulnerable populations whose health may already be compromised by underlying inequalities where they live in housing and healthcare and the other conditions of daily life. So this policy action agenda has been endorsed now by a large number of medical nursing and public health organizations, medical nursing and public health schools, and hospitals and health systems as well. And it's a 10-point plan. And it starts by declaring climate change a public health emergency. And then the 10-point agenda includes some of the issues that we talked about before, energy, how we make energy, that it be less carbon intensive, that we are energy efficient, so we need to use less sources of energy, that we think about agriculture and the ways that agriculture and land use can help us to draw down the carbon dioxide in the atmosphere, and the forms of transportation that we use, which right now are quite intensive in their use of fossil fuels, but could become essentially fossil fuel free if we make the changes that are needed. So 6 of the points in our 10-point agenda are directly beneficial to health. And I can talk a little bit more about how that works. So renewable energy and energy efficiency means using less fossil fuels and therefore less emissions that go into the air, less particles that go into the air, and less ozone that forms because of this. And this means our air is cleaner and healthier. And if we change to active transportation, meaning that we walk more, bike more, use public transportation, and use vehicles that don't pollute, that we will also have cleaner air. We can get where we need to go and we'll have cleaner air. Children won't be exposed to diesel particles when they take school buses, and the same thing for people who ride city buses. So there's just lots of ways that our air can be cleaner if we focus on transportation. And then of course, if we eat diets that have less meat in them and more vegetables, they will cause less production of methane, and they'll be closer to the Mediterranean diet, which has become very popular in recent years, and which is healthier. It has more fish, more vegetables, more fruits, and less meat in it. And then if we think about city planning, and we build cities or plant cities so that we've got more trees and more greenery everywhere, that means that the cities will be cooler. And those trees and plants will sequester, they'll take up more of the carbon dioxide and protect us from the heat. And of course, if the agricultural techniques are better, they will also have soil that takes up more carbon dioxide and leaches less nitrogen into our waterways, which means that our waterways will be healthier and we'll have more healthy fish. And so there are just lots of benefits to the environments around us and to our health because of these approaches. So these slides are really just some pictures that help to illustrate the clean renewable sources of energy and transportation. Of course, that includes bicycles and walking. And then this is the Mediterranean diet, which has more nuts and fish and less meat in it. And so that is the conclusion of what I wanted to say, and I'm happy to take any questions that you may have.
Thank you so much, Dr. Sarfaty. This was wonderful. I wondered if you might talk about a couple further pieces. The first is um, what you do to reduce your footprint. What kinds of things do you choose?
So I appreciate that question. And we have thought quite a bit about how we could reduce our own personal carbon footprint. And one thing we do, which really also is, is a step in favor of our health, is that we do a good deal more walking. So whereas we used to, hop onto some form of transportation to get to places that we wanted to go, increasingly we try to frequent places that are in walking distance, and to get out there and get there on our own energy. If we're a little younger, we might be using bicycles. We don't do that too much anymore, but we are lucky to live in a semi-urban environment where we can get to places just on foot. So we do a lot more of that. We're lucky to be in a place where we can purchase electricity that is made from wind sources. And so our utility has made that available as an option, and we have decided to go with that option. So the energy that's coming into our house comes either from the wind that is supplied by the utility, or we also put some solar panels on our house. And so we have some of our own, kind of self-made energy, if you will, and then we're getting energy from the grid that comes from renewable sources. Now, in our county, they did allow some solar arrays to be built that then were able to power a lot of homes in the community. And so they made people aware of this, and they were able to connect up to these solar sources. And so that was, another way that we were able to lower our carbon footprint, and we're lowering it at home. And another thing that happened, which we didn't plan, for very long in advance, but we had an accident with our car. My car was parked in a parking lot at work, and somebody had a medical emergency and conked out, and then drifted downhill and crashed into my car and really totaled my car. My car was undrivable after that. And so my husband and I realized that we needed to replace it. And we had thought about getting an electric car some years ago and thought, well, if we had the opportunity, maybe we would do it. Well, this opportunity came up unexpectedly, and we decided to go ahead and invest in an electric car. So we now have an electric car, and because you don't have to buy gas for it, it was less of an expenditure than we thought it might be. My husband figured out how many years it would take before we got to about the same. It was a little bit more expensive, and how many years it would take until we got to about the same level of expenditure that we would have made had we bought an internal combustion engine car. And it turned out that, it was about 5 years. It was not that long. So we realized that, we didn't have upfront funds that we were able to spend on the car, but we also were able to save, over a period of years, what we otherwise spent up front, which was more than the internal combustion car would have been. Now, the price of electric cars is coming down quite a bit. And everybody seems to think that it'll be just a few more years before those cars will be virtually the same price as other cars. And you probably have heard that General Motors, which is one of the biggest automakers in the United States, has announced that they're going to be making only electric vehicles by 2035. So this is clearly coming, and that's really another important source of greenhouse gases. In fact, transportation counts for about 28% of all the greenhouse gases that go into the atmosphere, and a lot of that is from cars. Some of it, of course, is from buses and trucks. And there are also now electric buses and trucks being produced. So I think it'll be a few years, and then we'll start to see a lot more of those as well.
And there's a story ready for the plucking with quotes ready for you to use as well, right? Here's a solutions journalism opportunity of accelerating this transition to electric vehicles. So that's a really wonderful example to use. The last question that I had for you was, if journalists who are, or communicators who are watching and listening to this wanted to be able to connect with health experts who can talk about climate change, or provide a quote, maybe even by email or something, how could they find such people?
I'm so glad you asked that question. There are a couple of very easy ways to find physicians who would be happy to tell some stories or comment. And one is through our organization, which is www.docsforclimate.org. And so if you send an email, you'll see down at the bottom of the page, you can send us an email at info@climateconsortium. That'll get to us. We'll find you somebody to talk to. There's also an international group, which is the Global Alliance on Climate and Health. I think you can go to their website as well and put in a request to speak to somebody.
Um, Anything else that you'd like to add?
Not really. Thanks so much. It was a pleasure spending some time with you today. And I look forward to more coverage of climate and health.